Hi, I'm Dr. Chad Larson. So, what's the problem with belly fat? First of all, a little bit of belly fat is totally normal and actually healthy for you. Um, but it's the excessive amount of body fat, of belly fat that we're talking about. If you were to measure around your waist, around your belly button, for men, if it's greater than 40 inches, that's usually a problem. For women, if it's greater than 35 inches, that's usually a problem. But a little bit of belly fat's okay. That's not really what we're discussing here. It's when it's in a more excessive amount. And really the problem is that level of belly fat puts you at a higher risk for developing, pretty bad conditions like heart disease, diabetes, and certain respiratory conditions. So that's really the main issue of why belly fat is even a big deal. It's just it's a red flag. It's a risk factor. It puts you at greater risk for developing some of these much more serious conditions. So um, uh, there's an interesting article that was released just this month. It was published in the American Journal of Clinical Nutrition, and it looked at calcium and vitamin D helping to decrease belly fat, which technically is called visceral adipose tissue. And what they found out is they had two different subject groups. One group drank a juice that contained calcium and vitamin D, and another group consumed juice that was not fortified with these nutrients. And they found out at the end of the study, the individuals that were taking the fortified juice had a significant reduction in visceral adipose tissue, belly fat, and the group who did not have the fortified juice really did not have a significant amount of change in their belly fat. So it was pretty dramatic differences. And there's another study that was done a couple years ago in 2009, very similar type study, where they didn't use juice, but the subjects took a pill that had calcium and vitamin D in it, and they actually came out with pretty similar results. And these studies are done on overweight and obese individuals, and they found in the study that was done in 2009 in the journal of in the British Nutrition Journal of British Nutrition, British Journal of Nutrition, sorry, 2009. And what they found out is the individuals who had the greatest amount of loss of belly fat had started out with a lower level of calcium. So the lower the level of calcium that they had before the study started, when they took the calcium and vitamin D supplement, they had a much higher rate of fat loss. So nobody really knows the mechanism behind this, why calcium and or vitamin D helps to decrease belly fat loss, but there really does seem to be a significant connection. One hypothesis that was made in the 2009 study, which they didn't speak about in the 2012 study this month, but what they spoke about before is that one of the possible mechanisms is that the brain detects how much calcium is in the body, and it lets the brain know if there's a deficient amount of calcium. So it tells the brain if it's deficient to keep consuming more food, hoping that there's going to be some calcium in the food that the brain is desiring, and that'll hopefully to increase our calcium level. So people who have a sufficient amount of calcium floating around, the brain will desire a little bit less food. And if there's a deficient amount of calcium, the brain might tell the body to keep eating more food to help try and bring the calcium back up. So at this point, it's just a hypothesis, but it's kind of an interesting one. So the jury's still out on that, and when more reports are published in that regard, then we'll be happy to bring you those results. In the meantime, like usual, I've suggested many times to have your vitamin D tested, and at the very least take a very high quality, high potency multivitamin mineral supplement. So I hope this information has helped, and stay tuned for more information. Thanks.